evening. The Prime Minister, Boris Johnson, is tonight in intensive care at St Thomas's Hospital in London, suffering from the effects of coronavirus. Mr Johnson was admitted last night, but his office says his condition worsened during the course of this afternoon, and on the advice of his medical team, he was moved to the intensive care unit. Earlier today, the Prime Minister, who's 55, was said to be in good spirits, receiving treatment for what were called persistent symptoms, including a temperature and a cough. He tested positive for the disease 10 days ago. The Foreign Secretary, Dominic Raab, has been asked to deputise for the Prime Minister where necessary. Let's start tonight by going live to our political editor, Laura Kuenssberg, at Westminster.
We've been in a rather strange vacuum for much of the day, with very limited amounts of information about how Boris Johnson was after he was taken to hospital last night. We were told this morning he was in good spirits, even that he was still receiving red boxes full of government business and still in touch with his team. But shortly after 8 o'clock, an official statement from Downing Street with a very different tone. It's said to be as a precaution. The Prime Minister is said to be conscious, but Boris Johnson tonight, just across the Thames, is in intensive care. Less than a mile from Downing Street, Boris Johnson is in intensive care tonight, in a personal fight against the virus that the government and the country is trying to beat. Who'd have known on Thursday night that the health workers he applauded would be caring for him like this? Brief glimpses of Boris Johnson on social media made it clear he was struggling to shake the virus off.
My 7 days of isolation, alas, I still have one of the symptoms, a minor symptom of I still have a temperature, and so...
Now, after being admitted to hospital last night for tests, he is conscious, but as a precaution, Downing Street says has been moved to intensive care. And the Foreign Secretary has been asked to step up for now.
During the course of this afternoon, the Prime Minister's condition worsened, and on the advice of the medical team, he was moved in to a critical care unit.
With the Prime Minister now in intensive care, this is obviously an extremely serious situation. I mean, how worried should people be about his health and about who's in charge of the government?
Well, the government's business will continue, and the Prime Minister is in safe hands with a brilliant team at St Thomas's Hospital, and the focus of the government will continue to be on making sure, at the Prime Minister's direction, all the plans for making sure that we can defeat coronavirus and pull the country through this challenge will be taken forward.
Are you confident, though, that the government is under control tonight?
There's an incredibly strong team spirit behind the Prime Minister and making sure that we get all of the plans that the Prime Minister has instructed us to deliver to get them implemented as soon as possible. And that's the way we'll bring the whole country through the coronavirus challenge that we face right now.
Just after 8 o'clock, the official statement came from Downing Street, saying over the course of this afternoon, the condition of the Prime Minister has worsened, and on the advice of his medical team, he's been moved to the intensive care unit at the hospital. The Prime Minister has asked the Foreign Secretary, Dominic Raab, who is the first Secretary of State, to deputise for him where necessary. The Prime Minister is receiving excellent care and thanks all NHS staff for their hard work and dedication. Good wishes from friends and rivals of Boris Johnson's flooded online within minutes. From the First Minister of Scotland and the brand new Labour leader, and from someone who knows him and the unique job very well. The Prime Minister is now suffering seriously from a disease that does not pick and choose. Downing Street itself a place where the virus spread. Power and protection from harm. Laura Kuenssberg, BBC News.
Talk to Laura in a second, but first let's go to Vicky Young, our chief political correspondent at St Thomas's Hospital, where the Prime Minister is being treated. What can you add, Vicky, at this stage to what the hospital authorities are saying there about the Prime Minister's condition?
Well, after 9 days in self-isolation, he came under the care of doctors here last night and was admitted to hospital. Now, we know that he has been suffering from this persistent cough and temperature, something he couldn't shake off, which is why he was brought into hospital in the first place. Now, it's worth saying St Thomas's Hospital is one of the top hospitals in the country. It's just across the bridge from the Houses of Parliament. Now, we were told by Downing Street earlier the Prime Minister was working from his hospital bed here. We understand that he was given oxygen before that decision was made to move him to intensive care. Now, we're told that that has been done as a precaution. It's been done in case he needed ventilation to aid his recovery. Now, like thousands of other families who've been affected by the coronavirus, this is an extremely worrying time for him and for his family, especially, of course, his fiancée, who is pregnant and has been suffering with symptoms of the coronavirus herself.
Vicky, many thanks. Vicky there at St Thomas's. Let's go back across the river to Westminster Rob directly about the functioning of government. What did you make of the answer?
Well, I think Dominic Raab, perhaps not so very surprisingly, looked pretty shocked by how things have been moving tonight. The Foreign Secretary now is technically in charge, as he is the Prime Minister's official understudy, and he has been requested by Downing Street to deputise for him as and when. And government insiders are pretty confident. They say that the way that the cabinet committees have been designed to try to deal with coronavirus into 4 different groups, looking at all the important elements, that will continue to tick over. One cabinet minister had said to me that the decision making was pretty crisp, pretty efficient, and this had been happening whoever was in charge. But a Prime Minister, of course, is much more than a political mascot. They are, of course, also the most senior decision maker in any government, and at a time when there are so many dilemmas about the health and the wealth of the country, this is obviously a very serious moment for the government and the Whitehall machine. Even for the Prime Minister, who was popping up every now and again trying to sort of say that he was fine and he was getting better throughout this, it has created a sense already of not that much stability with him being ill, and even just when he was in the Downing Street flat. But now, with him in intensive care tonight, even though we should emphasise it's said to be as a precaution, this is obviously a grave moment, one that's very unsettling for the government. And at a time like this, which is a genuine national emergency, irrespective of your politics, of course, this is clearly a terrible time for the government to be without its figurehead.
Latest official figures on those affected by coronavirus across the UK have been released today, and they show that in total 5,373 people have died in hospital from the effects of coronavirus. That's a rise of 439 on yesterday's figure, and this is very important. These figures do not account for people who've died in the community or in a care home. Well, as intensive care units in hospitals right across the UK come under increasing pressure, including, of course, St Thomas's, where the Prime Minister is being treated, we now have a rare insight into conditions at one of the biggest facilities in the UK. This is University College Hospital in central London. This special report is by our medical correspondent Fergus Walsh and cameraman Adam Walker.
It is completely unimaginable, and we're not at the peak yet.
This is the front line in a war.
Apart from 2 patients, every patient we're looking after has got COVID. We can't cope with a big spike, we just can't.
Every day, some battles are won
Is one of the doctors here?
and some are lost. All the patients here are critically ill.
We're planning for many more patients, so all our theatres to be full of COVID patients and possibly beyond. It is, none of us have ever seen anything like this.
This used to be a recovery area for patients after surgery. Now it's an intensive care unit for COVID-19 patients. A huge part of the hospital has been transformed in order to deal with coronavirus.
I've been in intensive care nursing for about 23 years now, and I've never seen anything like this. Even the London bombings, I've never seen it in such a short, condensed period of time.
Many of the patients here are elderly or have underlying health problems, but not all.
I think perhaps I was a bit naive when we started. I'd assumed that it would be the older and the sicker. In here we've got a mixture from people in their 40s to people in their 70s. A lot of them have got high blood pressure and diabetes or a bit of respiratory disease. But some of them are coming through who are young and fit.
The patients here have severe pneumonia, inflammation of the lungs. They must be heavily sedated while on a ventilator, a machine which takes over their breathing. Patients can spend 2 weeks like this. Many drugs are being tested, but there is, as yet, no proven treatment for coronavirus.
So it's oxygen and organ support and amazing nursing care, really.
One thing that does help is turning the patients onto their front. It increases the oxygen getting into their lungs. What seems like a simple procedure takes time
Ready, doctor?
and lots of pairs of hands.
Okay, everyone alright? Ready, steady, 90.
With ventilated patients, extreme care is needed.
Okay, ready.
All of this while staff wear full personal protective equipment,
Well done, that's great. Okay, can we just check on the ventilation?
their only barrier against coronavirus. Every time a doctor or a nurse goes onto the unit, they must don full safety gear.
You can't wear this and work for more than a couple of hours because you've got a crashing headache, you've got a dry mouth, you have to get out.
Staff write their names on their aprons so they can be quickly identified.
So there's an emergency on the ITU. The head of critical care was seeing via walkie-talkie whether he could give a second opinion. Yeah, do you want it off and done? Okay. But he needs to be there, so the full kit has to be put on.
They use walkie-talkies because their visors mean they can't communicate on phones. It is draining, physically and mentally.
It's really hard, and some of our staff really can't cope with it. We've got huge number of nurses, doctors and physios, and not all of them can deal with it, so they can only spend a short time, or not just any time. It's not uncommon for some of our staff to have had panic attacks, and just finding this so stressful. So we've got to really support people. Some people just can't do it.
Despite the possible risk to themselves, the medical staff carry on. 12-hour shifts, 60 hours a week are the norm. They worry about the patients, about each other, and about those they love.
I think it's very hard on our family. My kids are at home, my wife's homeschooling. It's easy in a way for me. I'm doing my job. I'm busy all day. They don't really know what it's like here. Whether we're bringing home the virus, and they've just been amazing. Just let me do what I need to do, and I'm just incredibly grateful to them.
What is striking here is the sense of calm. In the face of adversity, doctors and nurses simply get on with the job.
The staff here are dealing with the biggest challenge ever faced by the NHS. They can save many of the patients, but sadly not all of them. And still, more patients keep coming every day.
And no one is sure how long this will last. For now, they can cope, but that depends on all of us playing our part.
What is your message to people watching or listening to this?
If people don't stay at home and they sneak out, this is going to continue to happen, and our staff are going to be exposed for longer. We're not going to have the equipment to do the best that we can by everybody who needs it. We do need to flatten that curve, and it's so serious, and I just wish people would really listen to what the government and we're saying.
In another part of intensive care, we met Ertan, who wanted to speak to us. 70 years old, he's a bus driver. He fell ill over a week ago and ended up in A&E.
What has it been like?
Well, with me, it was a terrible time because of my bleeding. Symptoms started with the temperature, short of your breath, and tiredness.
Instead of a ventilator, Ertan's oxygen is being regulated by this tiny device. If trials go well, they'll be mass-produced for the NHS in the coming weeks.
Well, hopefully you'll be able to see your wife again soon.
I'm hoping so because she's waiting. And I got daughters, grandchildren, they're all waiting for me to go home. And hopefully I will fight it. Definitely.
And so will the medical staff here. It is harrowing to see the devastation caused by coronavirus, and humbling to witness the resilience of nurses and doctors, the heroes of this crisis.
And Fergus is with me now. Fergus, that was a very powerful insight into the reality of what's going on in these units. Now, in granting you this rare access, What is the message that staff there wanted you to share with our viewers?
Well, the UCLH Trust really said it was crucial to reinforce the message on social distancing, that people really realise why this matters, and if anybody had any doubt about what coronavirus can do, then that report should dispel those doubts. Now, the care I witnessed there was absolutely superb, but the sheer numbers of staff it takes, doctors and nurses, was really astonishing, and it takes a heavy toll on them, wearing that PPE, that protective equipment, for hours on end. And we donated protective equipment to the hospital so we didn't deplete their resources, and it has had a profound effect on me, seeing the resilience and the professionalism of the staff. Same sort of team at St Thomas's Hospital. I filmed in their intensive care unit in January. Extraordinary team there as well. But my heart goes out to the patients and their families and the terrible toll that this virus is taking on them.
Fergus, once again, thanks very much, Fergus. More than 10,000 people have now died from coronavirus in the United States as the country is braced for the most difficult week of the outbreak there so far. There are more than 347,000 confirmed cases, with around a third of those in New York State. And today it was announced that authorities in the city of New York might start temporarily burying victims in a park because the city's morgues are almost full. Our North America editor John Sopel has the latest.
This is life inside an intensive care unit in Brooklyn, New York. Our partner network in the US, CBS, were allowed in, and everything about it seems frantic and on the edge.
This gentleman right here is a patient that really didn't have much underlying conditions, has developed severe respiratory failure as well as kidney damage from the virus.
Though the administration says there's no shortage of personal protective equipment, the reality is otherwise.
I'd like a mask like yours. I'd like all of us to have masks like yours. And these white suits like you have, and I have, what do I have on? What is it?
What is that?
What is it?
It looks like a garbage bag.
Yeah, it is a garbage bag.
This patient needs to have his breathing tube changed over. And look how much equipment it takes to keep one patient alive. The critical care doctor puts on ski goggles to carry out the procedure.
It's very, very difficult. It's like something out of the Twilight Zone. And I don't think any of us going through it will ever be the same.
Where New York is right now, other states and cities like Washington, D.C. are forecast to follow in the coming days and weeks. Donald Trump says there's light at the end of the tunnel. There may be in the worst hit areas, but for much of America, the darkness is yet to come.
This is going to be the hardest and the saddest week of most Americans' lives, quite frankly. This is going to be our Pearl Harbor moment, our 9/11 moment, only it's not going to be localized. It's going to be happening all over the country.
Meanwhile, in New York, they're struggling to manage the sheer number of deaths. Refrigerated lorries have become makeshift morgues, and a senior health official has warned that burials may have to start taking place in public parks. John Sopel, BBC News, Washington.
And here, tributes have been paid today to a care worker who died after she was thought to have been infected with coronavirus. 56-year-old Carol Jamabo, who worked as a carer in Bury, fell ill about a week before her death last Wednesday, and one of her sons has now tested positive for the virus. Our correspondent Dan Johnson has been speaking to her nephew.
Auntie Carol, she was somebody who was full of life, very loving, very caring. She was someone that was always there to support myself and the entire family. She was the type of person, wherever she went, she really uplifted the mood of everybody.
Carol was a mum to 2 young men and a carer to countless older people. A life lived full of fun and spent looking out for others.
Maybe 15 days ago, she was fine. She was contacting family members to check everybody was all right. And then 7 days later, got a call from my cousin, her son, to say that she was in a very bad state. Over the next couple of days, it just got a lot worse, and obviously the worst happened. You hear all the stories you know, stay home and everything, but it really hits home when somebody so close. It's very sad, you know.
There's been lots of talk about protective equipment, whether there's enough of that getting to NHS workers, but maybe not so much carers. Is that something that you've been concerned about?
Of course, they're probably one of the most vulnerable as well, being in such situations where they're going into people's homes. So if they're not having the adequate, you know, protective equipment, then it's a massive concern.
We've heard people who are in the front line referred to as heroes. Do you think that's something that's appropriate?
As she's put herself in difficult situations for the sake of, you know, helping others, you know, so isn't that the ultimate sacrifice one can make, you know, that ultimate act of selflessness? So, yeah, in that respect, I'll definitely say she's a hero, but, you know, I would rather have her here.
That was the nephew of Carol Jamarbo talking to our correspondent